here is a touch of a shortcut. We're going to switch the legs back to how you would normally have it. You guys have seen this some in the past, but there's a co-contraction that occurs here from this side adductors to the opposite side lateral flexors abductors, okay? Yep, and that's a very easy action to do. What I like about this, compared to having a person lift their leg in prone, is that can be difficult. That's kind of a lot of stress on the low back area. So if we have somebody that's more frail, or if there's nerve impingement, or if there's spinal fusion, blah, 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 I'm worried about the stress it would put on the spine or the SI joint or something. I limit having a person do the motion in that orientation. Pretty much I tended towards, especially if I felt more cautious, I wouldn't do it in prone at all. But this is a great way to activate anything here. The body can't help it. It's designed well related to this. But having a person actively move this leg is not causing any specific stress to the spine. It's just causing a co-contraction. So I really go to this as your main shortcut for doing a muscle energy technique on low back everything. That is the safest and by far the most effective. One, you can get the most leverage here in this position. You're not reaching to the middle of the table, all that stuff. I know I've shown it a few times in like demos and everything, but I just really want to reiterate, you got somebody with a low back thing, this is your best go-to if you're truly going to throw an MET at it. All right, and all they got to do, it doesn't have to be big, is just start to lift their leg up off the table. It doesn't have to be any bigger than that. It can be even smaller than that. And then I can chase where the hypertonic tissue tends to be. Does it feel more lateral, like it's obliques, quadratus, lumborum? Do I feel something? Does it elicit the symptom? Or is it further back? And as we go further and further back, we suddenly are going from this place where these diagrams don't do the best job. You can see how I'm pushing here. Look at that seam, how your lats come down and meet the lumbar dorsal fascia, how your obliques come over and meet that same line. That travels deep and actually interfaces with psoas, quadratus lumborum, all the way down to your paraspinal and erector spinae muscles. So getting that seam in line more pliable affects basically everything, including psoas. I would tell you to start with freeing this up before really trying to do like psoas stretches and releases and stuff like that. But look, I can keep going more and more posterior, traveling from here. I can be denting here. This could be affecting breathing, all that. If I just keep my angle going more and more posterior, I can get my elbow set right to the SI joint, or as close to it as you can get. And even applying pressure here and having them activate the opposite adductors, so it works really good. It's just the one that I can tell you, it's a low back everything, and then you just chase it. I tend to start very lateral, like I'm a magician cutting them right in half. And that's that 90-degree contact versus changing my angle more and more and more until finally I'm back here. But you could find a million spots or one particular one, but you get to make it be just a trial and error experience. All right, we're gonna do a little bit of all of it. Her low back's gonna be very much reduced in tone. So a little lift, good, hold, big breath, and slowly exhale and let the leg down. See how I couple the breathing with it? Now that one we've already worked on. So now I'm just gonna go more posterior and increase my elbow angle. That's all that I had to do. Oops. She didn't slide off. So. A little lift. And down nice and easy. And starting out, I really encourage you asking the client now, as I work through here, tell me if we find something that really jumps out at you. I keep it pretty ambiguous like that. Any of that feeling? Or is it more the lateral spot?
Lateral,
yeah. It's all seeming okay. They're good too.
A little bit.
So follow and a little lift. Nice and easy down. I have a little nuance here. It's like grab onto the traps. Distract them a little bit with a good. Or there, the spot I was just on.
That one there.
Okay, there we go. So more L4, L5. Probably not, it's just that. Erector spinae. Okay, again. And down. And one more. And down. There. A little easier.
Mm-hmm.
Good. I felt it soften. The action was easier, all of it. The biggest reason why I want to reinforce this is that the erector spinae of the lumbar spine will be the place, actually I phrased that wrong, is the place that massage therapists struggle with getting adequate pressure for people that want lots of pressure. Because in prone, it's at the center of the table, and you're trying to get yourself into an awkward orientation. Now I'm going to show how I accomplish that. But ultimately, I would say this is more ergonomically and body mechanics sound. To get yourself set in a position where you can really get yourself set, they can roll back into you a little bit, and get the bolster, the pillow, everything set where and you just don't have to be reaching, and all you have to do is start here. Wow. And it's just one of those where if I have a big one to showcase to you for interventions, please remember, even if you don't use sideline a ton, you could turn a person on their side real quick, do this over the sheet, flip them on the other side, over the sheet, go to supine. But don't hurt yourself and waste your time working on the low back and prone.